If you have ever had the thought that medicine in the United States is currently not really serving the people that it is meant to, and that mental health care is completely inadequate, then today's episode is for you. And Dr. Robert Smith, MD, is my guest. And we dive into the many reasons in medical schools, primary care, mental health care, why there are gaps in care in certain areas and inadequate and not holistic care in other areas, and a host of issues that range from the personal to the political. Dr. Robert Smith, an esteemed physician and thought reader, is sounding the alarm. Medical doctors need a fundamental training in mental health care. His new book, Has Medicine Lost Its Mind? Why Our Mental Health System is Failing Us and What Should Be Done to Cure, is out now. It not only exposes the problem, but also lays out a bold, practical roadmap for reforming the system and saving lives. He makes a compelling and provocative case for why mental health treatment and information must be widely available and not thought of as the province of only the psychiatric profession. For any person who has ever felt frustrated talking to a doctor about anxiety, depression, stress, or grief, Dr. Smith will provide validation and hope. This conversation is important as mental illness touches everyone, either personally or through someone we love. Unlike physical illnesses, the impacts of stress, depression, and grief are far-reaching and often invisible. The numbers are staggering. 1 in 4 Americans will face a major mental health crisis or a mental illness in any given year, and nearly 75% of those individuals won't receive treatment. We get into this and much more. All right, let's get to the interview. All right, welcome, Dr. Robert Smith, MD, to the Intentional Clinician Podcast. Glad to have you on today.
Paul, thanks for having me. I'm looking forward to it.
Excellent. And so am I. And as you mentioned before the interview, you are a primary care physician with some training in mental illness and psychology. But you have written a new book, Has Medicine Lost Its Mind? Why Our Mental Health System is Failing Us and What Should Be Done to Cure. Did I get that right?
That's it, yeah.
What should be done to cure? Okay. So, so I guess we should just start with a little bit of the bigger scope. Is what led you to write this book that the medical field is losing its mind? Can you tell us a little bit about that?
Sure. And I've been in academics now at Michigan State since 1985, and we've done tons of research. We've developed methods by which to train doctors in mental health care, as have others. I'm not the only one in this boat. And we've demonstrated that they work. It's effective. And indeed, it's more effective than what's being done right now. The problem, Paul, that came up is that and there's probably 1,000 or so others like me in medicine that are interested in getting better mental health care. Medicine is not doing anything about it. Mm-hmm. All of our efforts basically seem to go for naught. The information is there, what they need to do, but the motivation to use it is not. And here's the simple fact that underscores this, is that through 4 years of medical education and 3 to 5 years of residency, that's some 7 to 10 years, mental health training is only 2% of total teaching time. 2%. And remembering, as you know, mental health is the most common health condition doctors face in practice. Doctors are not trained to manage this. And you may say, well, what about psychiatry? Psychiatrists see no more than 10 to 12% of all mental health patients. And medicine is equally derelict there in not training more psychiatrists. And so what has happened is primary care doctors like myself are conducting 75% or more of primary care mental health care. And that's for some 90 million people in the U.S. Almost all of that's being conducted by primary care docs like myself. And you say, well, what's wrong with that? They haven't trained us to do this. That's where that 2% of training time comes in. Most of that training time occurs in the form of lectures. They'll give a lecture on suicide. And if you talk to medical educators and deans and program directors, they'll say, well, we do talk about suicide and depression. We have lectures on it, 2 or 3 times a year. And that, in fact, is true. But that's the 2% of training time. There is no supervised training with real mental health patients at all during training, except in the third year of medical school. People have an average, a 5.1 week rotation on inpatient psychiatry. That is supervised training. The problem there is that those patients are severely disordered. They are very unlike the patients doctors see in practice. And therefore, that really doesn't help. But even that's the third year in medical school. There is then the fourth year and 3 to 5 years of residency after that, where there is no reinforcement of training. And I would hasten to mention there is an exception to that. Family medicine and pediatrics residencies have tried to narrow the gap and do provide some significant training, but it's still not nearly enough for doctors to be managing all mental health problems like they now are. And so this is why, and medicine basically is talking to itself. Medicine keeps hearing that they need to do something about it, but they don't. And so to answer your question, how I got into writing a book, I've written this book for the public, also for medical people, but primarily for the public, to inform them of something scary that they don't know, which is what we're talking about, is that their mental health care is severely jeopardized because most of it's conducted by untrained doctors. And this is a major factor in this mental health crisis, which gets worse and worse by the year.
Excellent. So what I'm hearing is you're writing this to sound the alarm to help people, because That's now, right. While the medical doctors and MDs and DOs have in their scope of practice the ability to prescribe these medications that I'm assuming most of them, they haven't received a lot of hands-on training at all about
That's
what
right.
to do about this. And yes, of course, people should go to the psychiatrist if they can, to get more specialized care. But what you're saying is that most people, first of all, don't even receive treatment. I think you said in your book is that 1 in 4 Americans will face a major mental health crisis, and nearly 75% of those individuals won't receive treatment. But the ones who do are going to their primary care doctor, who may not be at all related to the ability to have the right prescription, or it might actually screw things up further because they're not seeing the whole picture. Maybe they're pressed for time. That's kind of what I'm hearing. Is that what you're kind of saying here?
No, that's true. And this disparity, only 25% receive any care at all. This compares to something up to 80% of people with physical disease problems do receive care, and it's quality care because doctors have extensive supervised training in all these various physical diseases. Now, the 25% who do receive care, most of it is by untrained doctors. But look at the other piece of that. 25% receive care, It's not quality care, but 75% are being overlooked altogether. And the problem with this is either being overlooked or being inadequately treated. When patients lack treatment for mental health problems, bad things happen. There have been over 200,000 deaths from the opioid epidemic. There's still something like 15 to 17,000 a year. These deaths were all caused, and we're talking not about illicit drugs, but prescribed opioids like Vicodin and OxyContin. These drugs are all prescribed by MD and DO doctors who are not trained in their use. Doctors are not trained in chronic pain. And so it came out, these drugs are all safe and they work. And so doctors picked it up. Their main teaching came from pharmaceutical representatives who have no training in anything but promotion and PR. And so that is the problem with the opioid epidemic. Now what has happened is there are millions of people addicted to doctor-prescribed opioids, and doctors are not trained either in managing addicted patients. And so this is a problem, just compound. I mean, other examples are 48,000 suicides a year. Half of those people, Paul, see their primary care doctor or another medical doctor. It isn't just primary care, it's all medical doctors, but it's mainly in primary care. Half of those people see their doctor in the 2 to 4 weeks before they commit suicide. This is an ideal spot to recognize, to suspect the problem, identify it, and do something about it. Doctors don't do that, but it's not their fault. They're not trained in this. Now, of course, they will receive a lecture maybe once or twice a year in residency and maybe in medical school sometime, but they don't have supervised training in managing a suicidal patient. This is in contrast. When I was in residency myself and when I trained residents, the resident receives supervised care in virtually all physical diseases, from diabetes to heart attacks to emphysema. We see real patients and are supervised by people expert in that. That supervised training does not occur with mental health in medicine. Over 4 years of medical school and 5 or so years of residency. So it's this lack of supervised training. Yes, they do provide a few lectures, but that's in the 2%, and it simply is inadequate.
Thank you for that. That really makes sense. So what I'm kind of summarizing here is that while a lot primary care and other doctors have really good training in identifying physical diseases and diabetes, heart issues, liver, kidney, skin problems, whatever you want to call it, in their specialty or primary, they are completely lacking a lot of training and at all or hands-on experience with mental health cases. And thus, people may come into a clinic complaining of something, but because they're not screened for, depression, suicide, certain things, that person may end up getting maybe treatment or maybe just a checkup. And then, like you said, the suicide, 48,000 a year, they might go, unfortunately, down a dark road, perhaps even suicide or addiction or something else, because of the lack of training. And I know that I've heard this before, that recently a lot of primary care doctors have been giving people little scales for depression, little papers that they fill out. The issue there is a lot of people don't often tell the truth on those, or they're kind of overlooked because they're only a 5-question scale, right? Can you talk about that at all?
Yeah, well, a couple of things there. And let me, again, I've said this already, but emphasize it. It's not the doctor's fault.
Oh, sure.
Doctors sometimes get a bad rap in the papers. My doctor doesn't listen to me. He just asks about physical problems and gives me medications.
Right.
It's not their fault. They are doing exactly what they've been trained to do. And to their credit, many doctors take this problem very seriously and have tried to learn mental health on their own and have done a decent job of it. The problem is, in spite of that, the mental health crisis continues to worsen, and it is such a massive problem that taking weekend courses and things, which are helpful, but they don't cover this supervised aspect of training that doctors need. And you mentioned these questionnaires. A paper just came out again emphasizing what I think you're alluding to is that the suicide question on there, people often don't answer it accurately. And to properly assess suicide requires that the doctor directly inquire about it, but the basis for that even being effective is that the doctor have good relationship and communication skills. Doctors are not taught this very well. One of the advances, however, in medical school training has been most schools now, this didn't happen when I went to medical school. Most schools now receive some students now at medical schools receive some training in communication and doctor-patient relationships. It's usually in the first year of medical school. And this is an advance that medicine has made. It's one of the few that they have made towards mental health care. The problem is it's in the first year of medical school, and there's no reinforcement of it after that, over the next 6 or 7 years. But it is an advance. But back on the suicidal patients, you have to have a decent relationship and skilled communication abilities to elicit suicidal intent from someone. And so simply giving them a sheet of paper and having them answer it, that does not answer the question of controlling suicide. It is a help because we do pick up some things that way, and it should continue to be done, but it's not enough.
Definitely hear you on that. And usually, and what, from just cultural observation, doctors are often the first front line that patients will go to versus
That's
I'm a
right.
counselor. And oftentimes people will come to us because the doctor said, hey, you need to go see a counselor for a little while and possibly a psychiatrist, right? And that's possibly because they were upfront about what was going on. But doctors are the front line. And what I'm hearing is it's almost like we need a solution, not only in training, but it's almost what I'm hearing is almost like we almost need like some sort of specialist doctor who can really take in the whole narrative. What are your ideas here for some solutions? I guess this is my question, because I know you've written you wrote a textbook, Essentials of Psychiatry Care, and you talk about bedside manner and other things. But can you tell me what some of your ideas are? Because I'm hearing this gap big time. You're looking at the stats.
What you said was right on. There needs to be somebody who can put all the pieces together. That is primary care, and that's where most people start if they have a medical problem. And people don't always discern whether it's mental or physical, and so almost everybody goes into the system through the primary care doctor. And that, of course, is then where all the multiple factors should be integrated, correlated, and then deciding on what needs to be done, if they need to be referred to a cardiologist or if they need to be referred to psychiatry or whatever. But the primary care person is the key part of that. The problem that we're talking about is that this primary person does not receive training in the most common problem that people come in with. So it is difficult for them to put that part together, notwithstanding, again, that many of them have worked very hard to counter this through their own efforts and have been successful in many instances. And we cannot blame the primary care doctors for
Absolutely
this.
not. They're overwhelmed. I mean, the kind of if I did an anecdotal observation, because I know a lot of this you based on facts and stats and things in your book, but if I was anecdotally saying what I've seen from primary care when I visit the doctor or doctors I've met is that they're overwhelmed and swamped with patients. There's not enough primary care. And also, if you think about monetary, it's sometimes more lucrative to specialize in surgery or kidneys or liver or ENT because you can specifically work on that patient with your skill set and do some sort of procedure that is predictable. Where as a primary care doctor, your day is way less predictable because you could have a client with type 2 diabetes or pre-diabetes in one room, somebody else who's suicidal in another room, somebody else who hurt their toe in another room, and you've got to figure, jump between different types of care and different interventions. So it almost seems to me that the United States, because of this wildly off the charts mental health crises, almost needs more doctors or more specialists, if you will, to be able to help the primary care doctors in their offices, right? Yeah. Because like I said, in the counseling office, there's definitely people who, are researching and reading things on the internet and go, okay, I think this is a mental health problem. Let me come in and see this counselor. Now, in our work here and there, we'll go, wait a minute. This is definitely mental health, but there's something else going on here. Hormonal, possibly genetic, possibly some sort of large pattern. You need to also see a doctor and also see a psychiatrist so we can have a continuum of care. But like what you said, the catch-all is really the primary care office where we get referrals from. But you said, like, people don't know, is this a mental or physical issue I'm dealing with? Maybe both, right? So that's a whole other factor.
Often both.
So it's kind of like almost like a Sherlock Holmes situation. But where's the time? Now we get in, I don't want to go too far into the insurance and the time issue, but does the primary care doctor even have the time? They don't even have like you said, like they've had to go do the training on their own, which is unfortunate. So we do have a crisis. We have these doctors that are being put in these positions where they're the front lines. We have more counselors and psychiatrists, being trained, but I think obviously I not enough. So, and they're not the front lines. They're usually the secondary, tertiary, catch-all. So tell me some more about what your thoughts are on this. I love that you wrote the book on it so people can read the book, but what are your thoughts?
You're raising a number of issues, and I would just emphasize the need for primary care. Right now, primary care is dwindling. It's down to no more than a third of doctors are now in primary care. And that's the topic maybe for another discussion sometime, but that is a crisis in itself for just the reasons we're talking about. A second point that you're raising that I think needs to be addressed is psychology. All counselors like yourself have always been outside of medicine. They're not part of medical education. They need to be brought into medicine somehow. And I worked. In fact, there's a group in Flint, Michigan, that has psychologists take postdoc training in medical psychiatry. And these have been very effective. I think there are 8 or 10 of them by now somewhere. This was the first one, I think, in the country. And so psychology and other counseling people are a rich resource that is largely untapped in medicine and medical education. And how to do that, I talk about that to some extent in the book. So that is another piece of the problem of how we can bolster our mental health forces. Psychology right now, the figures see somewhere in the range of 10 to 15% of all mental health patients. And so psychiatry sees, say, 12%, psychology sees 12%. That's where the remainder, 75%, are seen by primary care docs. And that's how the numbers fit.
Okay, excellent. And so what I'm hearing is possibly having a clinic with more integrated care. Is that what we're sort of talking about?
There is a strong data support for this. It's called collaborative care.
Yeah.
It works famously. Other terms for it are integrated care. The common denominator of all of these is that there is a skilled mental health professional that has contact with the primary care clinic. They may not be on site, or they may be on site. The bigger the clinic, the more likely somebody to be on site. But there is access to mental health care. And there is usually always on site a skilled psychiatric nurse or mental or medical social worker with training in psychology who helps to mediate that with the primary care doctor. These have been shown. A friend and mine, Wayne Caton, started collaborative care. It's been 25 years ago, and it's been proven repeatedly to be successful. Better outcomes than standard medical care. And this is the ideal we seek in the long range. The problem is, as I've said, the mental health crisis is worsening. And so if this is so effective, why are things getting worse? And we're back to the same problem. There simply are not enough psychiatrists. There are not enough psychologists that are involved in medical issues. There's simply insufficient numbers of skilled mental health professionals. Most of the success in so-called collaborative and integrative care has occurred in big university institutions where they have federal funding for the research that's going into it. It has as yet been unable to spill out into the rest of the health community. And so it's an ideal we point to, but it's not solving the problem right now. The only thing that's going to solve this right now, it will take, the way psychiatry is in the U.S., it will take decades before they can generate enough psychiatrists. Tomorrow, even today, medicine could start training the primary care and other medical doctors in mental health issues. And again, we're not trying to make psychiatrists or psychologists out of them. We simply want them to be as competent with, say, depression, anxiety, substance abuse as they are with diabetes, heart failure, or emphysema. We're not trying to make psychiatrists out of everybody, but they need to be as competent with mental health as they are with physical health.
Yes, that makes complete practical sense to take all the swath of doctors we already have, get them trained in it, and perhaps some of them will add some sort of triage to their clinic, even if we can't make a full integrative clinic, perhaps co-locating a therapist or a nurse practitioner or somebody to help screen mental health. Because like you said, it's such a huge crisis. If we could get a co-located helper to these primary care clinics, and especially I've heard in rural clinics, like you mentioned, the university clinics are quite equipped. I mean, I've had phenomenal anecdotal evidence that people that live near university hospitals are getting great care. People, you mentioned Michigan. University of Michigan has a great reputation. Michigan State has a great reputation, right? But what about all these people in the rural areas, right? Where are they? They're going to the same doc who doesn't even have the training, who knows about it perhaps, but isn't able to maybe. Go ahead.
There's some interesting data on that. What you're saying is psychiatrists and psychologists tend to congregate in university communities and particularly in the northeast part of the country. There are vast swaths of people and areas in this country with no help. 95% of counties in the U.S. are judged to be inadequately staffed in mental health care. 50% have no psychiatrists at all. This is often rural. Can you imagine what it's like in a rural community with an overworked, untrained doctor having to manage severe and less severe psychiatric problems? And this is it. This is where the crisis is coming from and why it's getting worse by the day. And yet, medicine is not doing the obvious. Train more psychiatrists, bring psychology in, but that's going to take a while. Today, they could start training the primary care docs who are seeing 75% of all patients, but they don't do it.
Well,
and they know these data. It is not that these data are unfamiliar to them.
Well, it does seem like this starts getting into economics, because a lot of doctors and psychologists and therapists might want the amenities of a large university town or a larger city, and yet there's a lot of them there, right? There's a lot of people you can, if you go to Los Angeles, you could choose from phenomenal doctors and therapists there anywhere in the whole city. But if you're out in the middle of nowhere, in the middle of the salt desert of California, you may be devoid of help, except to do telehealth, which is useful, but in many ways inadequate. What I noticed, the only silver lining of the pandemic that I could find was that it opened up mental health to telehealth reimbursement by insurance. And what we found at the clinic I work at was we had all sorts of people since 2020 from rural areas asking for telehealth appointments who had never been exposed to a therapist. And I'll tell you, the severity of issues that we were seeing from those areas should be addressed in person, but there was no one for them to see except for the community mental health centers, which are often understaffed, overworked, and even they have an inadequate amount of care. They're dealing with the most severe people that are ending up in the hospital and jail, whereas your average person could be getting help. So it's a society-wide issue. Now, I like that you're taking to task your profession, because I think that's where your niche is, and you should. And in my profession, I would say we need more. I'm not sure who has to start doing this, but I think there needs to be market incentives for therapists and doctors to be able to work in spaces that would maybe cover a tri or quadruple county area that's underserved. Now, I know they have a small program through the government. I don't know if you know about this, called National Health Service Corps. Have you heard of that?
I have, yeah. I don't know much about it, but I have heard it, yeah.
I can explain it for the listeners just for a second, but it's a program that is, if you get your full license of, MD or DO or LP or LPC or LMSW, something, I think RN also. So what they'll do is, after you get your full license, you can apply for one of these programs, and they're in pretty much every state, and they're in underserved areas. And you move there because it's on site mostly. I think. I mean, you could look at. I'm sure there's some telehealth positions now, but you move there, and they pay you a salary to work at one of these clinics that is rated understaffed, or the county's understaffed, or whatever. And then in exchange for that, after 2 or 4 years, they pay off a giant chunk of your student loans, which is nice.
I am familiar with this. I've forgotten the name of it. Yes, I got it. Yeah.
Which is great. However, I think this is too small of an intervention. I think, the market is dictating that the doctors are better equipped and better paid in the larger cities. So thus we have this massive deficit of good not good, but more accessible mental health care in the large cities, and not. So then what are the results of this in the rural communities and underserved places, or places where even in the big cities, sometimes people can't get health care because of other reasons, economic? What are the results of not treated mental health? Well, suicide, violence against others, substance use, decreased work productivity, oftentimes I'm not trying to blame mental illness for this, but massive relationship issues can occur, right?
Oh, yeah.
And
Unnecessary divorces,
huge.
unnecessary job laws. I mean, something like 50 to 70% of the homeless and incarcerated population have mental disorders,
Yes.
which are unrecognized for the most part and untreated. If you had enough trained doctors, many of these people could have been recognized 10, 15, 20 years ago, worked with them and prevented that. You can prevent some divorces, job losses, incarceration, homelessness if we had an adequate mental health care system. Tom Insel, I mean, we're getting at Tom Insel. He's the former director of the National Institute of Mental Health. And who would know more about mental health than him? He has said that current mental health care is so bad as to represent a human rights issue. And people are not aware of this. People are not aware of what you and I are talking about today. And this is why this needs to go to the public. Medicine is refractory, Paul. It's not changing. People have been having conversations like you and I are having, 25 years ago. Medicine has been warned of this problem since the 1970s. Medicine has also had proposed for it a so-called biopsychosocial model, which integrates the psychological, social, mental, emotional with the physical. And medicine early on seemed to embrace it. It's in everybody's mission statement. Person-centered medicine, patient-centered. But that's the only place it is, because they still haven't changed mental health training one iota. If anything, it has been reduced since the 1970s. So medicine gives lip service to some of these things, but when push comes to shove, they're not doing the job. It's still 2% of all training time devoted to mental health care.
Goodness gracious. So this is almost to the point where it's going to require probably, I mean, these things start locally. I almost think a city has to take this up as a human rights issue, maybe even the state, and then eventually nationally. And we know this because when the opioid crisis bloomed, which was due to what, if you watch the documentaries and read the novels, pretty or not novels, if you read the books about it, was due to a opportunistic drug companies finding a niche and really driving the healthcare of in that area for pain treatment, which is horrible. And really a crime, much more of a crime than the people got fined for it. They got fined and they should have been in jail. So, I mean, that's a societal issue right there.
Yeah.
And so I think as a society to do mental health care, it's going to take a lot more than mission and vision statements.
Yeah.
The systems themselves, the payment systems, and the will of the government to fund these sort of things, because I do think it's going to take government intervention. Right? We've seen that before with certain health crises. How does that actually play out so that people have more access and the doctors get more training and there are more trained people doing what's right for the community? Right? How do we do that? Because right here, I mean, the most wild thing is that, like you said, if people were given adequate care and we had adequate mental health and we started doing this in, like, let's say 50% of the counties instead of, right now it's 95% are underfunded or something like that, or understaffed. What in the world would happen to our society in America?
Right.
What would we be like? What would happen in our schools and our workplaces, if these things were taken seriously? I think some of this is a cultural disease of what I would call reactionary, market-driven and fear-driven stuff versus prevention. Because what I hear is when a PCP doctor sees somebody, we don't know where we're at, but we have to start with the prevention, or oh my goodness, it's intervention time, right? So, and in counseling, our whole thing is prevention if we can. Go ahead, sorry. What do you say?
I love what you're talking about. And let's talk a little more about prevention.
Mm-hmm.
Medicine, as we said, excludes mental health, right? They don't
Right.
train in it. As part and parcel of this, medicine does not train in non-mental health, psychological, social, emotional issues. And so, how might that play out? Lifestyle factors, drinking too much, eating too much, not exercising, smoking, these are all psychosocial issues. Undergirding all of these are psychological and social directives. Medicine does not train its people in prevention or in using these skills. Now, of course, a doctor will say you need to quit smoking and try to cut down on your drinking, but that is insufficient. That's just that goes in one ear and out the other. Getting people to change these habits is in the field of called motivational interviewing. It's labor and time intensive to teach it, and labor and time intensive to implement it. You're trying to convince people to do things they don't want to do. They would rather keep drinking and smoking and eating. And so this is not an easy task, and medicine completely botches that. Evidence for which is that the prevalence of obesity in 1990 was 15%. Today, it's near 50%. If medicine was interested in prevention, that would never have happened. Now, here's another one that will blow your mind. Remember, 2025 annual healthcare expenditures were $5.6 trillion. Trillion with a T.
Oh, wow. Okay.
And that's mostly addressing all these physical diseases in the hospital. It's not on mental illnesses. It's on heart attacks, strokes, cancer, emphysema, kidney failure, all sorts of things. This is what populates your hospitals. This is what insurance companies underwrite. This is what drug companies prescribe medications for. It's what equipment companies provide knee transplants and heart transplants, not heart transplants, but knee transplants, ocular implants. Okay. $5.6 trillion is being spent on all this stuff. 80% of all heart disease, diabetes, strokes can be completely prevented. 40% of all cancers can be completely prevented. Let's just say we could prevent 50% of all this, okay? Half of $5.6 trillion is $2 to $3 trillion a year. That's $20 to $30 trillion in 10 years. That's how you correct the budget deficit. That's how you provide health care for everyone. That's how you provide college for everyone. That's how you double the defense budget if you're interested in things like that. Right now, because we don't prevent, medicine is invested in the status quo. This money is all going to the shareholders of these various institutions I've just mentioned. The so-called medical industrial complex, hospitals, insurance companies, drug houses, equipment houses, now runs medicine. Doctors and medicine have lost control. And these are the people who are benefiting from the status quo. They don't want mental health education. There's no money in it. They don't want prevention. It would cost them tons of money. Now, having said all this, these are not bad people. They've got bottom lines. They report to shareholders. They're doing their thing. But the problem is the value issue. Their values are the bottom line. Medicine's values are patient care. And right now, the bottom line, profit, has taken hold of all of medicine, so it overrides patient care. And so the solution to this is what you said earlier, and Don Berwick has mentioned this extensively, is there must become a independent federal board, analogous to the Federal Reserve, which governs banking.
Yes.
And they control banking. This federal board, and Berwick calls it a healthcare accountability board, would be independent. It would be populated by not just professionals, but by patients. And it would determine how medicine was practiced. And it would be sure that values focused on patient care primarily. This doesn't mean you have to have socialized medicine. There can still be insurance companies and drug companies and so on involved in it. But their values should not override patient care values. And that's what this board would ensure. And that's what needs to happen. Medicine and the medical industrial complex are too engaged and enmeshed in the status quo. They are not going to change on their own.
I agree with you 100%. I've been thinking about this for years, and there's half solutions everywhere, right? I mean, one of the current solutions is certain cities are now suing large food companies because they're accusing them, and rightfully so, I think, that a lot of this food that's marketed towards children should have the same warnings as cigarettes, except not for your lungs, but for obesity. And obesity, as we know, affects 40-something% of the population in the U.S. or 50. I can't remember what you said, but
close to 50 right now.
Right, which then that leads to diabetes, hypertension, all these other chronic issues going on. And
it's cost effective if you do something about it. Yeah.
Right. So if we prevented things, massive industries and sub-industries and subcontractors would lose their profit. The hard part is, like we said, I don't know, people can read this. Blue Cross Blue Shield started as a nonprofit, and at the end of the year, the money
it was altruistic. That was the intent.
The money was sent back if you didn't use it at the end of the year. We were all pooling the money, and it's turned into a profit, which goes to a very few. Now, I'm not an economic expert, but I would say this: when the incentive for profit is your driver, that can affect quality. And right now, it's not just affecting quality of healthcare in the U.S., it's affecting the delivery and restricting prevention
access
and
to
access.
Care.
Right. It's preventing. And that is one of the massive killers of people, but also puts doctors in a position to have to treat defensively, thus utilizing more surgeries, more drugs, more invasive procedures, which make more money for the shareholders, which is insane if you really kind of deconstruct it, versus, like I've said this before, and I've said this on many podcasts, I'll say this again. Did you know that the reimbursement code for family therapy, which is 90847, is paid on average 30 to 40% less than the individual psychotherapy code 90837? Did you know that?
Yeah.
What
I didn't.
On what planet does that make sense? Because I go into a room with a family, which means I could affect the whole relationship of the parents, perhaps the couple, the siblings, whatever, and make a larger change than just working one-on-one with the person, because I'm working with the whole system. And I'm taking a pay cut to do more work.
Yeah.
And that's just in mental health. And that makes no sense to me.
The same thing obtains in medicine. Primary care requires the brightest, the best, the psychologically most stable people in all of medicine. And yet they're paid oftentimes a third of what a surgeon might do that does nothing but replace knees all day long.
What the?
I mean, it is backwards. And you talk about Blue Cross Blue Shield. Um, it was altruistic at the outset, but it was also run by surgeons, and that's why
Ah,
surgeons have always been paid more, and I've always run that. You're making a good point earlier. I wanted to come
oh
back
yeah,
to
sure.
is right now what you're saying. Medicine's tinkering at the margins with the mental health problem. They're adjusting fees. They tried to increase primary care fees for doctors so they'd have a little more incentive to see them, even though they're still not trained. The problem I'm getting at, and has medicine lost its mind, is there needs to be a radical overhaul of medicine. And forming this healthcare accountability board, they will run medicine. They will see that the medical industrial complex profit motives do not interfere with patient care. That's where that comes from. Just like the Federal Reserve right now sees that the interest rates stay appropriate. And this will take place. There's an interesting vehicle I propose and has medicine lost its mind for how to do this politically now. And here's what needs to happen. We need to form a federal commission. Could be presidential commission, congressional commission, could be a private foundation, Carnegie, Rand Corporation, somebody. What they will do is conduct a thorough investigation of all medical school education with the one idea of, is medical education being directed to maximize patient care, including mental health care, including prevention? They will find exactly what we're talking about today, that medicine is terribly derelict in doing that. Again, you're 2% of total teaching time to those things. That will be the impetus. That will be published. The public will become angry and they will demand change. And that's where that healthcare accountability board comes in. And sounds far-fetched? Well, look at the Vietnam War. The public got that war ended. Look at the civil rights movement, the women's rights movement. Ralph Nader's book, and talking about directly overturning an institution, Ralph Nader wrote Unsafe at Any Speed. He described the terrible safety hazard auto industry was producing or not producing. They had seat belts but wouldn't put them in the cars because they were afraid they'd lose money. And there were a host of other. His book came out. The public got inflamed. That led to the Traffic Motor Vehicle Safety Act, which is why we have safe automobiles today. They're incredibly safe. But it requires an impetus from the public to overcome often understandable profit motives to meet the public's need rather than profit needs. And as you see today, the needs of profit and the public are met in automobiles. They're incredibly safe. This can happen in medicine. That's what my book, Has Medicine Lost Its Mind, aims to do. It is to enrage the public, get them to set up this commission, and then they will oversee all medical care, not just health care, but research and education. And that is the way to control this medical industrial complex.
Well, I agree. I can't agree with you more. I think the hard part is we're in a strange world right now with a lot of digital distractions. And so, like you said, the Vietnam War and Ralph Nader's book, the public was galvanized. I
Yep.
want the public to get galvanized again. And I
That's
think
right.
it's starting to come because, for instance, there's movements against these sort of ultra processed foods, which we know are causing a lot of the issues we just discussed, but not all of them, because we're into mental health here. The mental health is so inadequate. I've said,
Let me interrupt one second on what you just said.
Sure.
I saw something just today from the AMA is something like 75% of all infant foods is ultra processed.
That is so wrong. And then we
It's
wonder
just
why everyone has
what?
chronic health issues in the United
Yeah,
States, right?
yeah. But you see, a board like I'm talking about, a healthcare accountability board, would see to it that those things did not happen. They do that for profit because it's easy to do and they make a lot of money on it and it tastes good to kids. This healthcare accountability board would see to it that that type of thing does not happen.
Accountability is the big word here. And I think that is difficult when the people setting the rules want the status quo to continue because of the profit motive. We have to figure out as a society how to move. So I can see the independent movements happening right now among moms and dads that are saying, I want to feed my kid whole foods. And that's a great thing, right? But it's inadequate because a lot of people don't have that education, right? Most Americans don't have that education. Now, I've said for years, just not to bring on a whole nother set of issues, because your book is about reforming the medical schools and medical profession, which I agree with, and the insurance industry, which would be a huge task. But I would say further, I've said this: what in the world are our schools not doing, teaching two topics? Number one topic. This is my little. If I had my druthers, right? The number one topic is every school in the U.S. and homeschoolers included teach a secular, important here, because I could see religions fighting over this. We could have all the religions involved to see what they agree would be in the curriculum. So it would be secular and not religious in any way, and could be tailored to any sort of belief system of what is basic mental health, what are your emotions, how do you set boundaries, what are best practices in relationships and communication, how do you deal with parents, how do you deal with teachers, how do you deal with schoolmates. And that is a class that happens one semester per year for every student in the U.S., and not just an anti-bullying seminar with a motivational speaker. Nobody cares about motivational speakers. Kids want it. Kids are hungry for information. So why aren't we teaching them these skills? Number one. Now, I know we had home ec class. That's kind of gone to the side where they would teach people with cleaning and sewing and all that. That's gone away. So we need a mental health class with communication and healthy relationships. Number two, a food class, food and exercise. Every year, not just 1 year. What is food? How do you eat food? How do you cook food? How do you read labels? What is possibly a better choice than eating something from the gas station? How do you grow your own food, for instance? There's so many kids who could learn about community gardens or even have some, have their own plants in the window or something like that, instead of relying on a system that throws away 50% of the food made in this country is thrown away every day. So instead of relying on marketing, right there, two things that could help prevent mental health issues and get people adequate help so they wouldn't have to go to the PCP. They could say, oh my gosh, I've got a huge mental health issue. Let me go straight to the psychiatrists and counselors, alleviating some of the issues of the PCPs being the first wall. Number two, food and exercise. How do you exercise? How do we do basic exercises at home? This sort of thing, I think, could make Americans patriotic again, because right now we're so divided and fighting about every stupid thing like a Super Bowl halftime show or whatever we're yelling about that is so pointless and silly and ego-driven. If we could look at our kids and say, my God, these kids are learning these mental health skills. They are learning how to eat. They're learning how to exercise. They're learning basic skills that are making us not only, obviously we're one of the richest countries, at least for now, in terms of money, but we have health, and health is wealth. And everyone knows that when they get past a certain age, I don't know, 60s, 50s, you learn that health is wealth. But are we teaching our kids that? No, we're teaching them that the point is to make money or whatever, right? So any comments on that? Because I know we're getting towards the end.
No, I couldn't agree more. And we are jeopardizing everyone's health because some select people are making tons of money off of it. And again, they're not bad people. That's what they do.
Yes, it's not. It's just that's they were people. Raised in. That's the culture. That's what the incentives are.
It's healthcare's fault by allowing the profit motive into it. And Many of these things people are doing, you and I are talking about, are tinkering at the margins, Paul. Nothing is going to happen because this is a monolith. Medicine is wedded to physical diseases, and the medical industrial complex is wedded to them for profit motives. They are not going to change unless there is a massive public outcry. I think we need to quit tinkering with insurance rates and with various aspects of that. They're important. They will come, though, only after there is an overarching revolution in medicine, and that's what we're talking about here.
I couldn't agree more. I think consumers want it. I can see that because oftentimes they're looking for someone to blame, right? And like you said, this isn't the doctor's fault. This is how they've been set up. And these people that are running these companies, this is what they've been told is the right thing to do. It's got to be a movement, right? But with patients, they blame, they want to beat up doctors and all of this. I mean, where is the real issue comes from the structure of the money and the incentives. And also, obviously, our end of it is, hey, let's get more education for these docs. But that's, I love your enthusiasm on that, but that is somewhat of a Band-Aid if we don't change the incentives to become a primary care doctor and to have adequate people in the clinic to help them,
This overarching healthcare accountability board would see to just that. They would adjust and I'm sure it would probably have to do with something on years of training. And if somebody in primary care had 7 years of training, and somebody in surgery had 9 years, there probably would be a minor adjustment, but not the disparity that there is now. And if you save in prevention, you obviate all these problems with doctors' debt, which is now driving them out of primary care. In other words, if you save $2 and $3 trillion a year, it wouldn't cost anything to go to medical school. It wouldn't cost anything to go to Harvard or wherever. And there's money here to be had. We just need to be willing to go after it.
Wow, I couldn't agree with you more. I think you're right. It's the small tertiary adjustments are not doing
they're not working.
They're not working.
The crisis prevention is worsening. Excuse me. Prevention is worsening. And mental health care is worsening.
Yeah. You're right. I mean, and it really does, if we want a system to work, and we have to quit pointing fingers, we have to set up the incentives and the structure to be adjusted to today's world.
Yeah. And it's purely a political issue. It has got the fox is in the chicken house is not going to correct the problem.
No. I don't think they want to drive themselves out of business. That's the whole.
Of course not. Of course not.
If we did it like from the top down, which I think is the right solution, we could repurpose.
That's right.
All of these jobs and all of these sub-industries, but it would be painful for them. But I do think what is worse, the pain of the industries getting angry that they're not getting enough profit, or all of the American people feeling confused and betrayed by not having adequate solutions and care.
Tens of millions of unnecessary deaths, of unnecessary complications. Excuse me.
Yeah. Like you said, every year, most of our diseases that we're having issues with in the U.S. are chronic and they're preventable.
Yeah. And we haven't even talked about, we keep talking about physical medicine, physical diseases, that's medicine's forte, right?
Right.
That's where all the training's going. Well, guess what? They're suffering, too, from this lack of psychosocial mental health training. 17% of all chronic physical diseases have a co-occurring mental disorder. It's not treated. The physical disease does not get better. It's not treated except in 12% of cases, because these people are all in medical settings. That 12% of treatment is by untrained primary care docs. So physical disease suffers not only for lack of prevention, but for lack of effective treatment.
Wow.
It goes on and on. Has medicine lost its mind? Goes into this in detail.
Yeah, and so, well, that leads us, just because of time. I really think that I'm glad that you wrote this book, and I'm excited for people to be able to access it. It came out in 2025, and I'm going to make sure that people have the link in there, which is Has Medicine Lost Its Mind? Why Our Mental Health System is Failing Us and What Should Be Done to Cure. Prometheus Books, 2025, Dr. Robert Smith, MD, physician and thought leader. And we're going to put also links in to your website for people to take action. And I'm assuming, can you tell us a little bit about what that is?
Sure. My website is Robert C. Smith, MD. Now, Smith's a common name, so don't forget the MD on it. It'll never get to me otherwise. So, robertcsmithmd.com. Click on that. That will bring up Has Medicine Lost Its Mind? Click down just once, and there's a little square there that says Act Now. Click on it. Up will come a sheet with 3 points. First one, open the emails that are listed there. One is to the president, the Attorney General, or the Surgeon General, National Academy of Medicine, your congressperson, and your 2 senators. These emails are all there. Open the email. Fill in the subject line. This is number 2. Fill in the subject line. Number 3, go down to the bottom of the page. Copy the sample letter there. Paste it into each email and send it. It is recommending this evaluation of all medical schools to demonstrate how ineffective their treatment is. This is what will start the revolution.
Okay, I love that. I'm putting that in the notes. I'm just writing that down to put in the show notes. So let's start there and take action and start talking about it in your community. And if you are involved in city council or any sort of political organization, bring it up. It's very important. So
bring it up on your social media. Talk to your politicians. Right, spread the word. I'm too old to be trying to make money. This will all be donated somewhere, so I have no conflict of interest. I'm on a mission, and I need your help. So spread this on social media, websites, and what have you.
100%. Dr. Robert Smith, it has been my pleasure to have you on the Intentional Clinician podcast, and I really appreciate your work and the book you're putting out and the action people can take, and all the other books you've contributed to and written. So I thank you for this passion and the no nonsense approach to the mental health and physical health, obviously, and what we need to do to change this system. So
thanks for having me, and thank you for being willing to be part of the revolution and air this problem. It's critical what you're doing.
Thank you so much, and I appreciate that, and I'm all about it, and this will be on all platforms for everybody to listen and share this episode. So
good. Take care.
Take care. And there you have it. This has been another episode of the Intentional Clinician podcast. If you are enjoying the show, please leave us a rating on iTunes or share the show with people you know. I would surely appreciate it. As some of you know, I am passionate about preventing future violence in the United States. I have started a nonprofit with colleagues called the National Violence Prevention Hotline, which is a 501c3 organization. We are endeavoring to gain funding and collaborators and volunteers so that we can start a 24/7 hotline and chat line to reach potential perpetrators before they may act violently. It is a bold effort to curb violence and save innocent lives by working to connect with potential offenders while they are in the planning stages of violence, help to de-escalate them, and provide resources so that they can get appropriate professional help. The National Violence Prevention Hotline is looking to open up a conversation about violence in society, the causes, and the solutions. You can learn more by visiting our website at violencepreventionhotline.org. You can get involved by writing your congressperson from our website, sharing it with your network, or even donating to the cause. If you are looking for an EMDR International Association consultant, I am a consultant and I can help provide 20 hours that you need to become EMDRIA certified. Just check out the show notes and send me a message and see if we're a good fit to work together. If you are in need of counseling, do not hesitate to make an appointment with a local counselor in your area. You can also make an appointment with the excellent clinicians at Health for Life Counseling in Grand Rapids as part of the Trauma Informed Counseling Center of Grand Rapids by visiting www.healthforlifegr.com. And if you are in the state of Michigan, you can also schedule a telehealth appointment. The recording you just listened to consists of the personal opinions of Paul Krauss and his guest, and while these are based upon the literature they have read and the experience in their respective fields, the information on this podcast should not be viewed or thought of as the definitive opinion on any subject. Listening to this podcast is not a substitute for treatment. If you're in a crisis, please call 911 or the National Crisis Line at 988. Support your local bookstore by shopping at bookshop.org. That's www.bookshop.org. It donates a percentage of sales to local bookstores all across the United States, which I think gives character to our cities and a place to hang out and a place to explore. You can order from the comfort of your own home online while supporting businesses near you. If you are a therapist and you are not involved in your local counseling or therapist or social work organization, please get involved to at least pay dues so that we can have lobbyists help keep mental health care accessible at the government level, and also expanding into schools and other places that need it. And also, if you didn't know, counseling organizations and professional organizations are working to keep us from becoming gig workers for a lot of large corporations who are coming in and trying to buy up local counseling agencies or basically pay you what they pay for people to deliver food to your house. So, get involved. Until next time on The Intentional Clinician, I wish you all a safe and peaceful week.